Hey, I'm Emma Garlett and welcome to It Blak. This week I have a very special episode. I have Minang Noongar woman Francine Eades, who is an Area Director for the East Metropolitan Aboriginal Health Service, here in the studio for It Blak. So welcome, Francine. It's a pleasure to have you, so thank you so much for coming in.
Thanks, Emma. Appreciate the opportunity to come and have a yarn with you.
This year you won a King's Honours Award, which is very significant, particularly for all the work that you've done in around COVID and being an Aboriginal woman leader in this space. And I just see it. And when I saw it, I was so excited because I saw you and also Vanessa Elliott, who was recognised.
Yeah, from our board.
Exactly. Yeah. So to see two women leaders up there being recognised was just so humbling and nice for me to see that, because, you know, we often don't get recognised in our communities and sometimes people might not want to get recognised as well. So how was that experience for you?
Oh, look, I like to be someone just getting on with business behind the scenes. I don't like big noting myself or, elevating myself as little as I can. But, basically I'm an introvert, but come out and be extrovert when I need to be. But you're right. I think when we have our opportunities, it's really important to be opportunistic and highlight the health of Aboriginal people and the importance. All my life I've always seen having good health as being the best asset you possibly can have, because the statistics are pretty dire when it comes to our people. So, I've worked for 35 years and went straight from high school straight to university, did my nursing training, and my family especially and people I'm connected to, they always hear that. No, I'm not a doctor. Go see your doctor, make sure you have those regular checks, and so when something does go wrong, your doctor can be on top of it and look after you early, make sure that your outcomes are much better than they could possibly have been, And
I think it's that, you said something, if you don't have your health, you don't really have much at all.
No.
And I know, like a lot of my family and my community, health is a big issue.
Yeah.
It's hard. There's heart disease, diabetes, chronic health issues that are ongoing, kidney, like all of these problems.
Yeah.
But do you have any recommendations, I think, like in the future going forward, on how we can make sure that Aboriginal people actually have health outcomes and they're being seen, they're taking more control of their health and their life?
Yeah, it's not just our people being more motivated about their health, it's the system recognising some of those systemic barriers. We've all heard the horror stories about people's experiences, but I can say I've seen some brilliant frontline health professionals and how they've treated our families, but there still remains these gaps, the whole closing the gap agenda, the change in approaches by federal and state and territory governments now to calling out racism, health services being really proactive around that and looking at some of those really systemic issues that our people face. And because another issue is, if our people do have poor experiences, they're less likely to report it. So when we do get people telling us their stories, just making sure that we're really proactive as mainstream health services. Like much of my health career, I've worked in the Aboriginal community-controlled health sector, and, because historically Aboriginal people weren't welcome in health services, and, now I can talk to what we do at East Metro Health Service. We have Annie Young from the Muditch Court Aboriginal Corporation and Tracy Brand, who's the CEO of Durbal Yerrigan Health Service, who I recruited when I was a Durbal chairperson, and 4 years later she's still there, thank goodness. But they come and sit on our internal steering committee, and we have a local Noongar elder who sits on that with all of our executives. So we are really thinking, no, we want to be the leading health service in terms of our engagement with Aboriginal people. And, you know, we've got a meeting coming up next week, and we're actually putting it to Annie and Tracy as those CEOs. How can we as East Metro Health Service help you better service the Perth Metropolitan Aboriginal community?
And you mentioned something that I just want to touch on a little bit, and it was the barriers and the systemic issues historically that Aboriginal people have faced when engaging with health.
Yeah.
I know that you've done so much work to make those spaces more inclusive and make sure that Aboriginal people can access health services when they need it, and make sure that it's culturally informed practices as well. Throughout your career, you've done so much. So can you talk about that and maybe some of the great work that you've done in that space?
Yeah, I think, you know, you've got to be pretty Teflon coated, and, you know, as a nurse, you know, went up through the ranks, and it's just, you know, knowing what those stereotypes are about Aboriginal people and debunking the myths, really, you know, being, you know, just performing, getting the job done, but always thinking about, you know, your resilience and your self-care, because we know the odds are stacked against us, but in spite of that, and just your actions every day, always turning up, getting the job done. If I could go back to my, you know, 17-year-old self and tell myself what I'm in for, now 35 years being in health, I think I would really focus on, hey, remember your self-care. And, you know, I've lost count of all the study I've done in my life, but, you know, I'm also a trained epidemiologist, so I always like to look at the data, and people can't argue with the data. We've got a long way to go. There's been fantastic improvements in life and health outcomes for our people, but we have quite a way to go. I just think the time that I've come into this really senior leadership executive position it's really been timed really well, because I can see from 30 years ago where we've come in the overall national health agenda for Aboriginal people, and we're doing some truth telling, and I'm just so happy to be working where I am, because our chief executive, our board chairperson, all of our board members and our executive are really committed to you know, making the changes that we need to make. And we're really mindful that when people come to Royal Perth Hospital or any of our health services, it's not just from the metropolitan area. They come from desert communities, really, really regional locations, and, you know, really mindful of that journey that they take to come and access care. So all those ways we can improve their experiences and make sure that they stay for that, possibly in a lot of occasions, life-saving care. We're doing everything we can to enhance that experience. And, you know, a lot of people have my number, and, you know, when they call me, you know, the you know, collaboration and, you know, cooperation and, you know, intent of everyone to really try and do the best we can. All of our executive directors of our sites across our service, you know, we're really, it surprises me sometimes with where we're at. Like 18 months into the job, I can honestly say I'm really happy with the impact, but I know in terms of leadership, and this is the way I've always thought about it, is community are watching me and I'm accountable to community. So 24 hours a day, no matter what I'm doing, I know my community has those high expectations, but I'm always mindful of that and responsive when people need my help as well. And I'm grounded in, you know, native reserve on my birth certificate. You can't really get away from, you know, that knowing who you are, where you're from, and strong in your culture. And it really does help you with your leadership journey too.
And it's so powerful. And some of the things you mentioned there is it's so innovative, your approach to health, because it's not normal, I don't think, to include truth-telling as a part of a health service, but it's so holistic in its approach, because I just think when you say that the amount of wellness and mental health outcomes and preventative care, and it's a form of engaging people as well to actually build trust and build relationships.
And kindness is my mantra.
Yes.
You know, like I've really had a privileged opportunity as a registered nurse for over 20 years to be with people at some of the most saddest times in their life, and sometimes the happiest for babies, but you know, it's a privilege, and I've always thought I don't ever want to think that I've contributed to someone else's, you know, being a, how do I put it, like being a dampener on them and their experiences, you know, and just privileging their voices too. I think it's really special to work in the health field. And COVID, you know, the Public Service Medal, I feel so humbled by it. And but it was a major once in a lifetime experience, working with our now Governor General, jumping on police planes and going here, there and everywhere, but you know, really being respectful to the local people and the elders and being respectful in other people's country. And I was just blown away by, you know, talking to community and talking to them about how they want, you know, what they wanted to see us do, and being able to make it happen. It was a real privilege. Yeah.
And just seeing, like, hearing about the work that you're doing is so inspirational for me, because you have all these ideas and you're actually doing it, and then you're engaging with community and they're telling you what they want, and then you're doing it. Yeah. And so often that doesn't happen in a lot of areas. There's so much community engagement, people going out talking, but then it kind of stops there. But it sounds like what you're doing is, like, you're actually making a difference.
Yeah, we're working on a Noongar name for Royal Perth Hospital.
Oh, wow.
We have an overall Aboriginal Community Advisory Committee that works with me and the Chief Executive on any, you know, anything that they have concerns about. We make sure it's escalated to the top, and that's what I think impact is, like listening to our community. And you know, I've been jarred quite a lot throughout my 35 years, but I said, well, tell me what I can do and I'll do it. You know, don't get wild about it. Tell me what I can do to make a difference, you know, when I've had really challenging people, you know, and I always think some of the most challenging people that you're faced by, they're the ones that need the help the most, you know, and just making sure that we show that if you elevate it to me and call me, so I have some people stop me and say, oh, Francine, you know, this happened to me at one of your services. And I said, well, okay, who did you call? Can you please call me next time? Or what can I do? Tell me what happened. And so sitting and yarning with people, and then I always say, look, if I say I'm going to do something, I'm going to do it, and I will. What's your number? I'll get back to you.
You'll be on the phone every day. Constantly the phone will be ringing.
Yeah, but you know what? Our staff internally, our Aboriginal hospital liaison officers, I mean, some of our day-to-day people at the coalface in our health services, they're amazing, the work they do.
So your leadership style then, there's really no limit. So you're talking to the people that are your clients on the ground, and then you have oversight of all of those processes, which is really good, because often you have leaders and they kind of, you know, sit at that exec level, but then it doesn't really trickle down. But it sounds like your approach is from the ground upwards, and then you always have contact with everyone.
Early on I said, looks like there's a big gap in terms of our next tiers of leadership, and I want lead people at all of our sites. So there's, you know, Royal Perth Bentley Group, Armidale Kalamunda Group, and St John of God Midland, and we have the highest proportion of Aboriginal people in the state that live in the city of Swan. So next challenge is making sure that the community around there are really closely engaged with the hospital. And Linda Cresdy, the, you know, manager of Aboriginal health out there, my next challenge is working with her and making sure that community feels heard, and you know, in terms of what's happening at the hospital. So I just think, you know, we need a lot more Aboriginal health professionals across the system, making sure that we create those opportunities not just at the top or for people starting out in their health careers, but at every different level of our health services, I think is really important. You know, our people feeling more comfortable with seeing more Aboriginal people in the system will make a difference. But you know, within East, where we understand that there aren't many Aboriginal people. You know, we make up 3% of the population. So within our health service, where we've got allies and Aboriginal health champions, we've just put through the executive team. Board members are coming on board for that. Nurses are there 24 hours a day, and we're just working systematically through all of our nursing leadership around the importance of nurses coming on as well. So, we're recognising that Aboriginal people can't do it all, and that we need our allies and champions across the health system to help us, make sure that the care that our people get is culturally person-centred and culturally safe as well. So our target was 100 for the year, and we're already at nearly 80 Aboriginal health champions across our health service. So we're well and truly, and I must mention Ian Gentle, who does that with me. We tag team, and they're 3-hour sessions. People have asked, can we lessen the time? And I said no. The board and the area executive group have come for the 3-hour session. So really importantly that we keep the format the same. And yeah, we're just, really focusing on everyone across our health service coming on board,
It's really impressive as well, because you're building the capacity of people to be able to do more of this work and make a big change. So you're leaving a huge legacy.
And encouraging people, don't be scared to ask something. There's nothing that you can surprise us with, but how are you going to learn if we don't have that yarn and start having these safe conversations for people to really ask the questions they want to ask. Our young people starting out in their health professions, the sky's the limit, in terms of where you can end up and all those different places you can work. And it's been an amazing 35 years for me. But, those young people starting out, just understand, there's always opportunities to progress your career, and so many different ways you can go within the health system. Yeah.
And if you look back at your career and all the work that you've done, all the projects you've been involved in, the strategic and policy decisions that you've influenced, what are you most proud of?
COVID's right up there, I reckon. Everything we did in terms of that response was really thinking, we heard from all around the world about First Nations people being, overrepresented in terms of the deaths and morbidity, and we thought, well, my advice to the Premier and COVID vaccination commander was no, Juanita Bartholomew, who was my offsider, and she was a strategic advisor for WA Police. We have to do all we can to make sure that COVID stays out of WA. So I can honestly say that all those approaches were, top of everyone's mind was the impact that it would have been on Aboriginal people. But, the time I worked in, as a registered nurse, I think it's so easy to go off to Aboriginal organisations, but to be in mainstream and, really perform and debunk those myths about Aboriginal people and show that you're, you always show up and you get the job done is what I always stuck by. And my mum, she was a widow with 7 kids, and she worked 3 jobs after Dad died, and that's where I got my work ethic from. My sister might be a professor of medicine, but my mum was my role model.
It's been a real pleasure having you on It Blak today, and thank you for being so generous with your time today and talking to me about some of the fabulous work that you're doing and the impact that you're having in communities.
Yeah.
And I do agree that, you know, you're paving the way, and there needs to be more health executives at this level, and even in the future creating spaces for those young people to be able to have that pathway. So you're a real inspiration and such a role model to so many people, so it's really fabulous that you came in. So thanks for watching Paint It Black with me, Emma Garlett. Don't forget to subscribe so you never miss an episode.